some important decisions for our state. Obviously, we continue to manage the current Omicron outbreak and the Coburn cluster. Our contact tracers continue to do their work, as do WA Police, to help track down contacts and get them tested and into quarantine. But can I ask everyone, if you have any symptoms or if you have been to an exposure site, please go and get tested. The only chance we have of managing this outbreak is if people get tested and we track down all potential cases of the Omicron variant. I can't stress this enough. Now, on to our announcements tonight. Our Safe Transition Plan, which I first announced in November, was developed based on the impact of the Delta variant, which was prevalent in the eastern states for 6 months since it first emerged in New South Wales in June last year. The plan was based on a 90% double dose vaccination rate to give us the best protection possible. And that is something we are very close to achieving here in Western Australia, an amazing achievement. Under that plan, modelling at the time indicated we would peak at 338 daily cases with 62 hospitalisations and 1 life lost each day. It was our Safe Transition Plan to provide us with the softest landing possible. Unfortunately, the world changed in December. Omicron arrived. Of most concern was how easily transmissible and infectious Omicron is. Unfortunately, even double-dose vaccinated people aren't strongly protected against Omicron. Omicron is a whole new threat that we can't ignore. As the Prime Minister has said, Omicron has changed everything. And right now, we don't know the full picture of what Omicron could mean. There is insufficient data to make meaningful assumptions of what it would look like once Omicron takes full effect and case numbers peak over east. Except that we know because of case numbers, it is a very bad situation. Since the beginning of this year, other states and territories with widespread community transmission had been hit by a massive surge in cases. There's been a surge in hospitalisations around Australia, with an average of almost 5,000 Australians hospitalised a day since the start of the year with COVID. Since the first Omicron case was detected in Australia on December 8, there's been a 902% increase in hospitalisations in Australia, an increase of 902%. And sadly, this year alone, just 19 days into 2022, we have seen 664 Australians lose their lives to COVID. Delta was a real concern, but we knew being double dose vaccinated gave us the protection we needed. But Omicron is a whole new ballgame. It is a new state of emergency. We can't just shut our eyes and hope that it's different, because the facts tell us it is. What we do know about Omicron so far is that a third dose of the vaccine is so vital in giving people effective protection. So far, the science shows that people with only 2 doses of a COVID vaccine have only a 4% protection against being infected by the Omicron variant, just 4%. With a third dose, it can provide a 64% protection against infection. In addition, protection against severe disease is maintained at 80% to 90% for people with 2 doses, but increases to 98% for people with 3 doses. The science proves third doses make a stark difference against Omicron. It would be irresponsible and reckless for the state government to ignore the facts and ignore the reality of the situation playing out on the East Coast. It's expected they'll be reaching their peak of this current wave in coming weeks. At that point, after the peak, I hope we can have a better understanding of Omicron and what it means for Western Australia. Allowing hundreds or thousands of Omicron-infected people to fly straight into Perth from February 5 with no testing, no quarantine and no public health measures would cause a flood of COVID across our state. It would cause a surge in cases, a surge in hospitalisations, and result in thousands of people not being able to work or go to school. And we know that bad health outcomes lead to economic pain. It will cripple our community like it's doing on the East Coast currently. The Eastern States' experience has not been our experience. Western Australians are resilient. We've been in this together, and over the past 2 years, we've had a very different way of life. We've had very few infections and few hospitalisations. Today, we've seen Western Australia's unemployment rate go even further down to the lowest rate in the nation by a long way. This is the lowest unemployment rate in 13 years. WA has strong jobs growth. Businesses are successful and the economy is growing. We're in the fortunate position to be able to adjust our settings to put us in the best position to handle the Omicron variant and to protect Western Australians and the West Australian way of life. We know the third dose of the vaccine gives us the best protection. We currently sit at 25.8% of third doses for everyone aged 16 and over. What we saw with WA's first and second doses is we can achieve a higher rate. We can lift the third dose rate significantly. And we can give ourselves the best chance to vaccinate our children. If we can hold back this current Omicron outbreak, we will be one of the only places in the world that can achieve a high third dose rate before we reach widespread community transmission. Something worth striving for. It is worth saving lives, reducing hospitalisations, and limiting the number of people who have COVID and become very ill. Over the last few days, I've been speaking to my counterparts in other states and territories to understand their experiences and see what lessons they've learned. We are in a unique position here in WA. WA has always been safe, sensible, responsible, reasonable, and cautious. This week, I held a series of meetings, and late yesterday afternoon, we convened a special State Disaster Council meeting that went for some time. In light of what's occurred in the rest of the country, having closely assessed the situation over East and listening to the latest health advice, we have reworked WA's safe transition plan to fit the environment that now confronts us. WA's updated plan will begin to be implemented on February 5. We will keep our hard border controls in place, but with more exemptions, especially for compassionate cases. So from 12:01 a.m. on Saturday, February 5, the hard border will stay with new settings that will have a focus on both safety and compassion. Under the new settings, approved travellers are permitted to enter WA with testing and quarantine under the new expanded exemption criteria, which include returning West Australians with strong recent connections or with direct, legitimate family connections with WA, compassionate grounds including funeral, palliative care or terminally ill visitation, people entering for urgent and essential medical treatment, people entering WA for reasons of national and state security, people with specialist skills not available in WA, Commonwealth and state officials, members of parliament, diplomats, and people required to attend court matters and other special considerations will be given to those extraordinary circumstances determined by the State Emergency Coordinator or Chief Health Officer. Now, if you're coming from interstate as an approved traveller, you will need to meet the following requirements. Be an approved G2G pass traveller under new exemption criteria. Be triple dose vaccinated if you're eligible for your third dose. Return a negative pre-departure rapid antigen test 24 hours prior to departure by uploading your result as part of your G2G pass application. Undertake 14 days of self-quarantine at a suitable premise. And this means if there are people in the same premise with you, these household members must also self-quarantine for the same duration and follow the same requirements. You'll also need to have PCR testing within 48 hours of arrival and on day 12 of self-quarantine. And everyone at the self-quarantine premise is subject to mandatory use of G2G now, and in-person checks will be undertaken by West Australian Police as and when required. Additional requirements are in place for domestic road travel to keep WA safe, including entry via the Kununurra border will only be for transport, freight and logistics and border community residents. For international travel into WA, entrance will be permitted if they meet the Commonwealth requirements to enter Australia under the arrivals cap, are an approved G2G pass traveller under the new exemption criteria, undertake 14 days of mandatory quarantine. With the recent changes we announced, if eligible, entrants can undertake 7 days of hotel quarantine and 7 days of self-quarantine at suitable premises subject to negative test results, with appropriate PCR testing as required. Current entry arrangements remain unchanged for transport, freight and logistics, maritime, aircraft crew, rig, platform and specific industries approved by the State Emergency Coordinator and Chief Health Officer. Future decisions on border controls will be considered over the course of the next month, following a review of the Omicron situation in the East. I know this decision will be unpopular with many people, as holiday plans and some family gatherings will have been disrupted. For that, I am sorry. I understand exactly what this means for many people who are hoping to reunite without any restrictions. But from February 5, there are enhanced compassionate exemptions. If we proceeded with the original plan, we would be deliberately seeding thousands upon thousands of COVID cases into WA at this point in time. That is not what I'm going to do, especially when the science says we need to boost third doses and so many young children still need to get their vaccine. It would be reckless and irresponsible to open up now. I can't do it. I understand that many people have planned around this date, and it is important we now provide people with a pathway to reconnect with families on compassionate grounds in a safe manner. WA will be taking on more risk as many people enter under compassionate grounds from February 5. But also we know the let it rip strategy with low third dose vaccine levels doesn't work. The proof is on our television screens every evening. We have an opportunity to do better, and that's what we will strive to do. What will remain unchanged for now is our robust testing, tracing, isolation and quarantine regime. This will stay. It has served the state well. We may well have to go without this regime when there is widespread community transmission, but we are not at that point now. Next week, we will convene another State Disaster Council meeting. We will look to finalise the remainder of the public health rules and settings that will be required for when we have high caseloads of Omicron or when border controls are eased at some point in time in the future. This will include a definition of close contacts in a widespread community transmission environment and what is required of COVID positive cases. As I said earlier, third doses are our answer in the fight against the Omicron variant. With our updated plan, we have a chance to get our third doses up to give WA the best vaccination coverage. It also gives us a chance to ensure kids aged 5 to 11 get the opportunity to get vaccinated and have some level of coverage before WA gets widespread community transmission. Please get vaccinated. Visit Roll Up for WA now to book your appointment. This is not how I imagined the beginning of this year would look like. I'm deeply concerned about the effects of the Omicron variant thus far on the eastern states. But I'm confident that WA's updated plan provides the best possible chance for people who need to travel into WA to do so safely. It's compassionate, it's responsible and it's safe. I'll now hand over to the Health Minister and we'll come back to take your questions shortly. Thank you very much.